My presentation is Throwing Mechanism, again, by Blaine Weaver. There are the 6 phases of throwing. Starts with wind up, stride, arm cocking, arm acceleration, arm deceleration, and follow through. The anatomy of the elbow only includes 3 bones: the humerus, ulna, and the important structures of the ulna. The proximal structures are what's important at the elbow. And on that right picture, you can see where everything articulates, including the humerus and the radius. These are the important structures of the radius. The articulation between the radius and the ulna is where pronation and supination occurs. And the articulation between the radius and the humerus is where flexion and extension occurs as well. These are the muscles of the elbow. Some of these also go through the hand. The biceps brachii action is supination, elbow flexion, and also does some shoulder flexion. The nerve is musculocutaneous nerve C5 and 6. Triceps brachii action is elbow extension. The long head also stabilizes the shoulder, extends the shoulder, and adducts the shoulder. The nerve is radial C6, 7, 8, and T1. The brachialis action is to flex the elbow. The nerve is musculocutaneous and a small branch from the radial C5 and 6. Brachioradialis action is to flex the elbow and assist in pronation and supination with resistance. The nerve is radial C5 and 6. Extensor carpi radialis longus and brevis both extend the wrist and abduct the wrist. It also assists to flex the elbow. The nerve for extensor carpi radialis longus is radial C5, 6, 7, and 8, and brevis is C6, 7, and 8. The extensor carpi ulnaris extends the wrist and adducts the wrist. The nerve is radial C6, 7, and 8. Extensor digitorum extends the 2nd through 5th fingers and assists in wrist extension. The nerve is radial C6, 7, and 8. The anconeus extends the elbow, and the nerve is radial C7 and 8. The extensor indicus extends the 2nd finger or the index finger. It also adducts the 2nd finger and may assist in wrist flexion. The nerve is radial C6, 7, and 8. The flexor carpi radialis flexes the wrist. The palmaris longus tenses the palmar fascia. It also flexes the wrist and may assist to flex the elbow. The nerve is median C6, 7, 8, and T1. Flexor carpi ulnaris flexes the wrist, adducts the wrist, and assists to flex the elbow. The nerve is ulnar C7, 8, and T1. Flexor digitorum superficialis flexes the 2nd through 5th fingers. It also flexes the wrist, median C7, 8, and T1. Flexor digitorum profundus flexes the 2nd through 5th fingers. It also assists to flex the wrist. The nerve for the 1st and 2nd is the median C7, 8, and T1. And for the 3rd and 4th, it is ulnar C7, 8, and T1. Pronator teres action is to pronate the forearm and assist to flex the elbow. The nerve is median C6 and 7. The pronator quadratus pronates the forearm, and the nerve is median C7, 8, and T1. The supinator supinates the forearm, imagine that, and the nerve is radial C5, 6, and 7. The elbow ligaments include the joint capsule, which covers the entire elbow and all of its ligaments. It also includes the ulnar collateral ligament, which is in 3 sections: the anterior, posterior, and medial or transverse. the annular ligament, which crosses the radial head and holds it in place, and the radial collateral ligament. This is a picture of the joint capsule. This is the ulnar collateral ligament, the anterior, posterior, and intermediate bundle. The annular ligament that covers the radial head. The radial collateral ligament. The first phase of throwing mechanism is the windup. The injuries at the very beginning of the windup are very low and there is little muscular movement. The elbow is stabilized through this. The windup muscles is biceps brachii, brachialis, and brachioradialis to bring the elbow into flexion. The purpose of the windup is to balance and stabilize the body in preparation for the other phases of throwing. The second phase is the stride phase. During the stride phase, the elbow is very stable. It's kept in flexion, and there's little injuries resulting from this. The stride muscles also include the biceps brachii, brachioradialis, and brachialis. Stride movement is the movement from the balance point to when the lead leg contacts the ground. The upper extremities stay positioned while the lower extremities transfer momentum through the trunk. The third phase of the throwing mechanism is arm cocking. The arm cocking injuries include muscle tears, ulnar collateral ligament injuries, ulnar nerve damage, and avulsion fractures. You can see from the picture there's a great amount of force that goes into arm cocking. Arm cocking muscles include the triceps brachii, anconeus, extensor carpi ulnaris, extensor carpi radialis longus and brevis, flexor carpi radialis, flexor carpi ulnaris, and flexor carpi profundus. The arm cocking movement starts when the lead foot contacts the ground and ends when the maximum external rotation of the throwing motion. Extreme amount of valgus forces are placed on the medial elbow from the loading of the arm. Arm acceleration phase is the fourth phase of the throwing mechanism. The arm acceleration injuries include posterior elbow impingement, olecranon fracture, valgus extension overload syndrome, and medial epicondylitis. The picture on the right shows what valgus extension overload syndrome is. It's posterior-medial impingement, chondropathy, osteophyte formation, and loose bodies of the medial side of the elbow. Arm acceleration muscles are triceps brachii, anconeus, pronator teres, and pronator quadratus. Arm acceleration movement begins at maximum rotation of the shoulder and ends when the ball is released. The rapid and forceful extension of the elbow and slight supination of the forearm. This is what causes the injuries to the medial aspect of the elbow. Arm deceleration is the fifth phase. Arm deceleration injuries. There are little to no injuries that occur at this phase due to the little amount of motion at the elbow. It just stays in extension after arm acceleration. Arm deceleration muscles include the extensor carpi radialis longus and brevis, extensor carpi ulnaris, and extensor digitorum. Acceleration movement begins with the release of the ball and ends with the slowing of the arm through eccentric contractions. Little movement at the elbow occurs during deceleration, and wrist extension occurs eccentrically for deceleration. It's pretty much the contraction of the muscles in place at the elbow, slowing the arm down. The sixth and final phase is the follow-through phase. To know injuries that occur during the follow-through because this is where the relaxation of the muscles occur while the arm is being brought across the body. Follow-through muscles. These are all the muscles that return the body to a resting position when the throw is complete. Follow-through movement begins after the arm is decelerated and ends with the final resting position and balance from the throwing motion. There is slight flexion at the elbow, but this occurs due to relaxation of the arm as it crosses the body, coming to the resting position. Here are the sources. And Eric Dick.